Assalamu alaikum. Today we will talk about how can contagious diseases spread among the society from one to another, and this is very important issue because now we are in the same problem. We are living in this problem. First of all, again, I will repeat that contagious disease is the disease that can be transmitted from one to another. Okay, it is the same as infectious disease, but when we say infectious disease, we refer to that this disease comes from a pathogen. When we say contagious disease, we mean that this disease can pass from one to another, can transmit, and mostly very easy to transmit. What can spread contagious diseases? There are four main factors. We summarize all the factors in four classes. The first one, water and food, what we drink and what we eat. Second, from other people, from a person to another. Third, from animals. Fourth, contaminated objects. Okay, let's talk about them one by one, and inshallah this will be very, very important. Water and food. Actually, here we summarize it in the book. They wrote more about it, but here it is summarized, and I didn't add to it. Water and food supplies can be contaminated and cause sicknesses. You know that the water that we drink and that comes to our houses is treated in specific units, in special places. They take the water, they treat the water to remove from the water all the dirt, all the pathogens, to be sure that we have clean water in our houses and for our drinking. Also the food. You know that we have to clean our raw materials of food very well before eating. If we bring, let's talk about that very well now. If we bring vegetables, we have to clean the vegetable one by one, and every one we should be sure that we remove everything from the surface. We can add, if it has leaves, we can add some vinegar to the water or some salt to the water that we clean the vegetables in. Okay, the same for the fruit, and that's it. To be sure that we are eating clean fruit and vegetables. Also, we have to clean Allahumma salli ala Sayyidina Muhammad, to cook the food very well, especially if it was meat. I will add this part. If it was meat, if the eggs and meat can transfer salmonella. This is a type of bacteria. Okay, salmonella can cause typhoid disease, and this is a very, very bad infection. And it can force you to stay at home for about 2 weeks sick. Okay, this is a serious infection. From what? From eating uncooked meat or uncooked eggs, or if you didn't clean your hands, if you if you handle the meat and the eggs, then you use your hand to eat, also you can transfer the salmonella. So eggs, very important to clean the eggs and to cook the eggs very well. Also the meat, especially if it was beef meat, it can transfer the salmonella. I will add this information here, very important. From person to person, through the air. You are shaking hand with someone, then you talk to each other, or someone sneezes or cough in the room, and what comes from his mouth fills the air beside you. For sure, the pathogen will come throughout your respiratory system. The same. Very, very important to be careful from such dealing with people. So these habits, we should learn them now and stay being careful, even if the corona problem finished. We have to stay with these habits later. Like, we have to cover our mouth with a tissue, or at least if you couldn't find a tissue quickly, with your arm quickly, okay, and be sure that you are not sneezing in front of someone. Try to have another direction. Okay, this is for you if you did it. For others, for you, if you are in the same place and another one sneezes or coughs, be sure that you try to have your face in another direction, or leave the place even. When you shake hands with anyone, especially if you feel this person is sick, try to clean your hands quickly, okay, with sanitizer or with water and soap. Water and soap are very enough, by the way. That's it. Sometimes also there are some viruses. They are harder to be transmitted, but if they are transmitted, also they are harder to be treated. They are very, very hard to actually. HIV virus and the virus C, both can't be treated. If someone catch them, he will stay with them to death. So how they are transmitted, as I told you, by the body fluids, يعني by the blood, or through the sexual relationships, and that's it. Sometimes by using contaminated equipments. If these contaminated equipments come beside a cut or a wound in the body, the virus can pass in. That's it. Animals to people now. We know that insects, also some ticks, other animals can spread diseases. We talked about the malaria. The malaria is a very serious disease also. It is caused by a protist called Plasmodium. Okay, this protist lives in dirty water and in special places, not every place, but it can affect a mosquito. If this mosquito bites someone, this person will take the Plasmodium from the mosquito. So the mosquito can transfer the malaria from or the Plasmodium, which is the protist that causes the malaria, to people. Contaminated objects, for sure, this is very obvious. very very obvious that if someone sick used a glass of water, for example, he drank from this glass of water. Imagine that you will drink after someone who drank from a glass, and this someone has a pathogen. What will happen? For sure you will get it. Also, if you just use the things that he used and you didn't clean your hands, then you eat, خلاص, you moved the pathogen inside your body. You understand me? You know, a very very important source to move the viruses from one to another or from area to another are the money papers. That's why here in Saudi Arabia, from the beginning of the corona, since about 2 months, they stop receiving money from outside, because the papers of money, they take the virus. يعني someone is sick, he take the money from his bucket, he paid to the seller, then as usual, the same cycles, the money can come to your hand. You take this money as a change, for example. You put it inside your bucket, then you take your sandwich and you start eating. What is this? You move the pathogen inside your body. As simple as that. Okay, so here we mentioned many examples also. Contaminated needles can transmit diseases such as the disease and the AIDS and the virus C. So you know that people in hospitals, they are using disposable needles. Injections are disposable, يعني they can be used once. After using it for one person, it has to be thrown in specific containers. Okay, now how we can reduce or prevent infectious diseases? Actually, we have to improve personal hygiene, as what I said. Let's learn, starting from now to the end of our life, that before eating we have to wash our hands. I want to ask you, before Corona, when you were in the school, when the bell rings, I don't see any student go to wash her hand before eating. I see all the girls take their food and go directly to the playground, and they eat together. I see some girls, they eat from their food without being careful. So let's learn from now. I will never put anything inside my mouth without being sure that my hand is clean 100%. This should be my habit from now, starting from now to the end of my life, to save my life actually. Okay, if I was in contact with someone and I knew that he is sick, I have to clean all my things, to clean my hands, to change my clothes if I know that he sneezed beside me or coughed beside me, like this. So hygiene is very important. Also, to clean our food, to clean our stuff, everything, anything you use, you have to be sure that it is clean. Okay, okay, I cleaned my hands, then I take my food and I put it in the table in front of me. If I don't know that the table is clean, that means nothing. That means I didn't do anything. There is contamination. I have to be sure that everything is cleaned. Beside, when you buy something, it is better to buy foods that are prepared يعني under the standard conditions. This is very important. Second, modern medical procedures in using sterilized equipments. Sterilized means they take the equipments and they put them in special devices to sterile them. What's the meaning to sterile them? They rise the temperature to very, very high temperature to be sure that any pathogen is killed. Or even if it was a virus, it will be damaged. Okay? Very high temperatures. Using gloves, using masks, all of these ways in the hospitals, in the medical centers, ensure that we are safe when we go to the hospital or to the medical center. You know now, because of this new circumstances and this new virus that all the world is trying to learn about now, it surprises everyone. The hospitals become now a very dangerous place. All the safety rules that they follow, all the standard conditions and the sterilization that they use, sterilized objects, equipments they use, and even though the nurses and the doctors they are taking this virus, unfortunately, and many of the medical staff are affected because of this virus. So this is a new circumstances. This is not the usual or the normal thing that we have. Okay, but they are working, alhamdulillah, now to develop their how they can how they can deal and treat this virus, because it's new. As what we said at the beginning, the viruses are able to change their genetic material. Changing their genetic material give them a new abilities that we didn't know before, and that's what happens now. Okay, vaccines are very, very important, and they provide the humanity with a great vaccines are considered the best invention. Why? Because vaccines could save many people's life, billions of people. Okay, how? Because they provide you with the immunity, with ready immunity, prepared immunity. Your body will not work to make this immunity. It will be given to it. So once the pathogen enters to the body, the vaccine will work on to activate the immunity directly. So the pathogen will be killed or will be destroyed without being sick. Okay, but if we want to wait for the immunity to be built, this will take time. Okay, and that's it. This is about the vaccines, and I will discuss with you something about the vaccines, because we talk about the vaccines, but I had some questions from the girls. I prefer to delay answering these questions until we have conference together to review the immunity and the infectious diseases. Now, also treating these diseases can be by using antibiotics if the pathogen was a bacteria or a fungi. Living cell, living particle enters to the body and cause an infectious disease. Okay? Biotic, it is given only to kill or slow the growth of bacteria and sometimes other microorganisms such as fungi. Not for viruses. They are not given to viral infection. That's why if you go to the doctor, if you have flu, if you have sometimes influenza, and you go to the doctor, your mother may tell the doctor, please doctor, can you describe an antibiotic for my daughter? The doctor will say no. Why no? Because the doctor have seen that your influenza is caused by virus. It is influenza caused by a virus. The flu, the influenza, virus, not bacteria. Not bacteria. Maybe after a few days, some bacteria will enter to your body and your sickness will develop to be from viral infection to bacterial infection. This will happen. This may happen sometimes. When that happens, the doctor will describe an antibiotic. But without having a bacterial infection, you shouldn't take any antibiotic. This will be bad for you. This will affect your immunity badly. If you take the antibiotic for a virus, this will affect your immunity in a negative way. Also, that's why now they prevent selling antibiotics without prescriptions, because people they become very, very bad users for antibiotics. Anyone, two women are talking on the phone. Oh, my daughter is sick today. I don't know what to do. The other woman on the other side will say, oh, don't worry. Go and bring Augmentin and give her. Oh, my daughter, the last time I gave her this medicine, I will give you its name. Go and bring it. This is very, very, very bad behavior and wrong behavior. That's why the Ministry of Health now prevent selling antibiotics without prescription. Okay? Because also, even if you have bacterial infection, not all the bacteria are treated with the same antibiotic. One antibiotic can't treat all the infections. So only the doctor can tell you what is the suitable medication, what is the suitable antibiotic. Sometimes even the doctor will ask for some investigations, for a blood test, to know exactly what is the name of the bacteria. Then the lab will tell the name of the bacteria with the suitable antibiotic for this bacteria to can give you the right antibiotic. The resistance. What is the resistance? Actually, there are some bacteria can develop. You remember the last year also you took that the bacteria can change its genetic material, and that's why we have millions of species of bacteria. And the same species of bacteria, for example, now it can be killed by an antibiotic. After a year, for example, you use the same antibiotic, it will do nothing for this bacteria. Why? Because this bacteria some of the bacteria could survive after taking the first antibiotic, and this bacteria develop its genetic material. خلاص, it knows this. يعني it has, like our body, we have immunity, they will have immunity also. They know this antibiotic. This next time, if you take the same antibiotic, this generation of bacteria will not be affected, will consider this antibiotic as sweet, nothing. Okay, that's why they are producing new antibiotics every few years. We see that there are some new names in the families of antibiotics, and that's why the doctor prefer not giving antibiotic until it is needed, not to encourage the building the resistance inside the pathogens, inside the bacteria. Okay, so you have an idea about the resistance. It's very important. Antiviral drugs, some diseases that are caused by viruses, they prepared for them medication that can destroy the virus or prevent it from replication, at least. يعني, because you know what is the problem when the virus enters to your body. It will start from a cell inside your body, and it will replicate from a cell to another, from cell to another. It will infect many cells, a huge number of cells, and replicates among the body. That's it. Okay, some diseases, if you know an infection sometimes on the lips. An infection on the lips. It is called herpes. It is treated by a cream. This cream is called acyclovir. If you use it, or Zovirax even. This is an antivirus, and many other antiviruses. Now they are trying to find an antivirus for the corona, and they are trying to make a vaccine. Actually, they found some treatment, but they can't give the decision before making studies, before making some experiments, to be sure that to use the medicine first on the animals, then start using it on the patients. It needs time. We are waiting, and inshallah, if we behave correctly, we can help ourselves and we can save our lives, inshallah. Stay home, stay safe, inshallah. This time will pass, everything will become again better than before, inshallah. Try to have good things, try to do good things in this time, to have a benefit from this stay at home. يلا السلام عليكم.